The problems with addiction have been highlighted during this COVID-19 pandemic and with the lockdown. Now, today is International Day Against Drug Abuse and Illicit Trafficking. Social Development Minister Lindiwe Zulu officially launched the National Drug Master Plan. She joins us now via Skype to outline what the master plan is about. Minister, good evening and thank you for your time tonight. What are the indicators of success for you with this master plan, areas that you would want to see implemented that would indicate that this is adequate response?
Well, it will be firstly the appreciation and understanding by our communities what it is the impact of drug abuse, drug intake, as well as the impact in our communities, from families to communities, to business, by the way, to teachers, to everybody. The time that we will be comfortable with this is when we know that the numbers of those people who are checking into drug rehabilitation centers is reduced. The production of drugs in the country, by the way, because it can all be said and done about us doing everything we can to make sure that there is a reduction, but it is also about how far and how fast do we get those people who are producing the drugs, I'm talking about hard drugs now, but it is also about how much we are communicating with our people to have a better understanding, because better knowledge is one that helps the nation and individuals to take the right decision about the abuse of drugs.
And what resources then are you putting towards that plan? Because it does sound like a multi-sectoral response that you require. For example, if you're talking about reducing the number of drugs being produced, hard drugs, illicit drugs being produced, that would require police to come on board, that would require the justice system to come on board as well, and of course it would require a response from health. So what are the resources that are going to be required for the success of this plan?
Well, really, before we even talk about the resources, before we even talk about the police, and before we even talk about justice, it's about ourselves in our communities, mobilizing and organizing ourselves to fight the scourge of drugs and illicit drug trafficking. That's the most important thing. You can put all your beautiful plans, your National Drug Master Plan, you can put all those plans in order, but if you are not having the support of the community, firstly by them appreciating and understanding, but also the individuals in society about the challenges of drug abuse in our country. And by the way, there is an issue here when we talk about drugs. People only think about the hard drugs that are being produced in some factories or something, as you recently saw the drug bust that was done by the police. The theme for this year is value yourself and make healthy choices against alcohol, tobacco, and drug abuse to minimize the spread of COVID-19. We're adding the COVID-19 because this is what we're facing as one of the biggest threats in our country. But generally, the abuse of alcohol, the abuse of drugs, and even tobacco itself is a big problem for the country. So that's why I'm saying, before we even run into the resources that we have to use or have to do that, the Department of Social Development can never have enough resources, because let me tell you, the challenge is, firstly, you have to have our centers for drug rehabilitation. The health department also gets under extreme pressure when people are using drugs. All other departments are affected one way or the other. Even in the prisons and all, you cannot be having so many people that are being arrested for drug trafficking, for illicit drug trafficking. So if you want to talk about resources, it's a huge amount, because you should look beyond the Department of Social Development. The Deputy Minister today indicated, for instance, that those that are in the drug rehabilitation, you have to spend 10,000 rands per person. Multiply that by all the people that are in those drug rehabilitation centers, and then you can calculate how much money we need for that. So that's why, for me, it's not really about the money. It's about whether we are reaching our communities we are reaching the drug abusers, we are reaching and jailing and catching those that are either selling tobacco illicitly or those that are selling drugs illicitly.